Good afternoon. I'm Sherman Chow. Brazoria County now reporting its first death related to coronavirus. Let's get you to the national headlines. The U.S. Army setting up a field hospital in New York City for non-COVID-19 patients to relieve stress on medical services. This as Texas identifies quarantine facilities statewide. The Trump administration is now looking at hazard pay for doctors and nurses on the front lines of the coronavirus fight, while social distancing guidelines are extended through April the 30th. Ohio today joining Texas in ordering self-quarantines for travelers from COVID-19 hotspots. We'll break down the Texas order in a moment. And here now is a live look at the Dow Jones. The market up about 500 points, about 2% of its value, as it continues to react to the $2 trillion stimulus package and a better sense of the national response. Right now, travelers driving and flying into Texas from Louisiana are ordered to self-quarantine. Governor Greg Abbott concerned about the outbreak with our neighbors. Janelle Ford explains the process.
Along Texas freeways, TransStar message boards are flashing a new alert, warning drivers coming in from Louisiana must self-quarantine for 14 days upon crossing the state line.
Failure to comply with this order is considered to be a criminal offense.
It's a dramatic expansion to the current statewide travel restrictions in place to try and slow the spread of COVID-19. Governor Greg Abbott says the move was prompted by reports that our neighbors to the east are the next projected coronavirus hotspot. The new rules went into effect at noon.
It will be enforced by the Texas Department of Public Safety at and near entry points from Louisiana.
Travelers will have to fill out a form telling troopers where they'll be quarantined, and the state says they will be following up at random to check on those people. The governor says those who do not abide by the orders could face jail time and a fine. The restrictions do not apply to travel related to commercial activities, military service, emergency response, health response, or critical infrastructure functions.
This is all driven by science, data, and medical assessments.
Additionally, self-quarantine is now mandatory for anyone flying to Texas from the New York tri-state area, as well as Atlanta, Chicago, Miami, Detroit, and all of California and Washington state. There is no timeline on when these restrictions will be lifted. Standing for Houston, Janelle Ford, KHOU 11 News.
And right now in Texas, there are more than 2,800 confirmed cases, which includes 38 deaths. That is less than 10% of the roughly 36,000 people who have been tested statewide. Here in Houston, 62% of confirmed cases are people between 20 and 59 years old. 29% of cases are people 60 years and older. This includes 11 Houston police officers and 5 Houston firefighters. Both those departments now changing protocols.
So you're going to see a difference in the approach from our firefighters. They're going to now be doing a distance assessment of no less than 6 feet with one firefighter before they bring in additional personnel to treat that patient, right? Now, it doesn't change for any cardiac arrest or trauma that requires immediate action. Our firefighters are going to be on the spot.
The city plans to use Kindred Hospital as an overflow facility if needed. And this week, City Council will vote to lease 2 hospitals that can be used to quarantine city employees and the homeless. The state is looking to use the Kay Bailey Hutchison Center in Dallas to house patients. 2 Metro employees have tested positive for COVID-19, and now Metro is making some additional changes to its routes. They're also trying to track down certain passengers. Aniela Ruiz joins us at Metro's bus station downtown with the latest.
Well, we know one of the people who tested positive for COVID-19 is a dispatcher. That person did not have contact with the public. The second is a bus operator. That person was at work last Wednesday. Here are the routes that we know the person took. Metro says he drove the 412 Green Link Circulator route from 6 a.m. to 2 p.m. from March 9th through the 13th, and again on the 16th through the 20th. And the 23rd. He also drove the Fuquay Park ride on March 24th and 25th. Metro is working on identifying and notifying those who rode the bus. But they're asking anyone on these routes to monitor themselves for possible symptoms for the next 14 days. Metro suggests if you develop any symptoms, you should self-isolate from others and contact your healthcare provider. The buses used by the driver who has tested positive have been temporarily removed from service for additional sanitation. Metro tells us they're also increasing their cleaning and disinfecting of all buses. Because of this, Metro is reducing its routes. All park and ride routes are suspended except those that serve the medical center. Local bus routes will continue to run on a modified Saturday schedule 7 days a week, and the Metro Rail will run on a Sunday schedule. All hot lanes are closed. Well, these adjustments could mean longer travel times, so they're asking people to plan accordingly. And of course, we have all of this information posted on our website. Anayeli Ruiz, KHOU 11 News.
Coronavirus having an impact on our daily lives as we have never seen before. So many questions, and now our statewide resources are ready to help you. This Thursday, we'll be taking part in the Texas Town Hall. We are getting answers to your questions about issues that affect you, your families, your businesses, as we all try to navigate this new environment. We'll talk about everything from the economy, jobs, strategies for working from home, and how to help your mental health. Join us Thursday night, starting at 7 p.m. And for more information about the coronavirus right now, you can text FACTS to the number on your screen, 713-526-1111. We'll send you back a link with additional information.